Today on the Dr. Oz Show.
We got 4 more faces to go. 1 flaw is fixed. Let's move on to our second flaw, wrinkles and acne scars.
My name is Jan, and I'm 52 years old. Ever since I hit menopause, I really feel like I've lost my youthful appearance, and it really shows on my face. I did start gaining a lot of weight. I gained about 35 pounds. I've worked hard the last couple of years to take off the majority of it, but my face hasn't bounced back. So even though I lost the weight, I also lost the elasticity in my face. My cheeks now have really deep wrinkles. I also have scars from acne when I was a teenager. I really wish I didn't feel so self-conscious about the way I look.
So Jan, what have you tried in the past to help with both the acne scars but also the loss of volume in your face?
You name it, I've tried it. I've tried dermabrasion, just everything you can think of.
Right.
Nothing has helped.
I brought you a world expert today with this great fix. Board-certified cosmetic surgeon Roger Bassin is a cutting-edge procedure. So what are we going to do today?
Okay, so what we're going to do today is we're going to do a procedure called Aqua Lipo first. So we can remove some fat cells from her little tummy where she has a little bit of extra fat. Okay. And then we're going to use that.
You happy about that?
I'm very happy about that.
Okay.
And then we're going to use that fat to fill in her depressions, her contour abnormalities, the scars, and the wrinkles.
Jan, slide back here, Dr. Bassin, and I can get a better position next to you. Perfect. All right. Now, this is a little bit more invasive, obviously, than the fillers we just looked at, because you've got to harvest the fat. So what's the advantage?
Well, the main advantage here is that the fat that we're able to get out using our Aqua Lipo device gives us fat that is perfect. It's viable. It's 90% alive, which is better than anything we've ever had in plastic surgery.
And if I understand correctly, this is a permanent fix. Unlike what we just saw, which has to be redone in a year or so, this would last forever.
This will last forever.
Are you ready?
I'm ready.
All right, take it away,
I am
Dr.
ready.
Bassin. She should.
Okay, let's go ahead and pick her shirt up.
Here, I'm the hand holder here. Thank you for helping, by the way.
You're welcome.
So we got this little trocar here.
Okay, so this is our Aqua Lipo device. Let's go ahead and pick up her belly.
So there's water that comes out of here?
Yes, so what this is it's got holes over here that will continuously suck up, okay? And then what we're going to do, step on it, Allison, and we have a very high-powered water spray.
Can you all see that spray?
So what this allows us to do is to perform the most advanced type of liposuction that's ever been invented. This is a true revolution in our field.
Let me know if this hurts.
So
that doesn't hurt you?
Can it?
No.
How can that not hurt you?
Well, what we have in here is we have a numbing solution that is actually
can you see this
in here.
Those are the fat cells that are coming out?
Yeah, these are our fat cells. So now we're able to give our patients...
Oh my goodness, can you all see that well? Yeah.
So now what we're able to do is to give our patients not only better liposuction results and not have to have her be put to sleep under general anesthesia because she's awake.
This is not hurting you?
No.
Oh my goodness. Well, since you're tolerating this, I want to show everyone why this is so innovative. I can't believe this. I'm not fine. Where's that ball I had before?
Can I help you?
I'm worried about you. All right. Here's a picture that I think will help elucidate why this is so unique. So there's the little trocar we showed, little probe, and it squirts the water, this blue stuff, out. And there's the skin up here, and there's the muscle beneath. Usually when you do liposuction, you rip away these blood vessels, which is why it gets bloody and traumatic, and it hurts because the nerves are with these blood vessels. But if you inject just water, you free up these fat cells, and as Dr. Bassin pointed out, they get sucked up into the trocar. You pull them out without damaging the blood vessels, the skin above it, or the muscle below. So maybe that's why it doesn't hurt, but I'm still a little bit beside myself. All right. Are you happy now? What are you doing? You took it. You did liposuction now.
You can keep going. Do you want me to turn over?
So, all right, let's shut it off.
Oh my God! Here, come on up here. That's fantastic. So come on, I'm gonna take you over here. This is remarkable that you're. All right, so now we've taken out a little bit of that fat. And again, yeah, go ahead and sit up here. Well, Dr. Bassin, actually, you know what? I'm going to go over with him. Explain to us what you're doing here.
Okay, so what we have in here is I have a canister that has pure fat in it. So what I'm going to do here is I'm going to take this 60 cc vial and I'm going to pick up this.
Jan, there's a lot of fat in there. You'd be happy about this.
She's going to love it.
It's good.
And let me tell you, Dr. Oz, we have our patients who literally drive themselves to our office for the liposuction.
Just show that to everybody. Can you see that vial of cloudy material? All right.
This is what we call the golden fountain of youth. The golden fountain of youth, because The doctors have been looking for the ability to use our own fat for not only filling in lines or wrinkles on the face, filling in breasts now. We're doing natural breast enhancement. We're doing it on the backs of the hands. We're doing it in the buttocks for what we call the Brazilian butt lift. So because this fat is so pure and so gorgeous, we can use all this fat for all these different indications now. So this is a real revolution in our field. So
okay, we have a small syringe with the fat that we just took out of her belly.
Exactly.
Okay.
Exactly.
Then we put a little needle on there, I gather.
Yes. So what I'm going to do is I'm going to go and take this one over here.
Are you ready for this?
This part I'm not sure.
This part you're not sure?
So okay. So
I just don't like to look at the needle.
So what we did here?
It's not that big a needle.
She's a little blanched.
Well, you should never look at the needle.
She's a little blanched over here because we just did a little bit of numbing backstage, okay? Because I really want her to be comfortable. And I made a little hole over here. So what I'm going to do is I want you to go ahead and open your mouth super wide. There we go. And then what I'm going to do is I put the little cannula underneath. And what I'm going to start doing here is I'm going to start laying down the fat.
Is this tolerably painful?
So right away you're
Not
going
painful at all.
That wasn't painful?
I didn't feel a thing.
I should point out this procedure was a brand new procedure. It's not been around for a while. You know, while we're doing, I just think about something I'm going to mention. I was struck as I watched your little piece, and I think this is true for a lot of you. You're worried about these cosmetic issues. Even if people aren't around you, you are. And because it bothers you, and because it prevents you from being the best you can be in your life, I understand why so many of you want to change or adjust or nudge the way you look. So, I'm trying to give you 5 simple procedures you can do. I know this looks invasive, but I'm trusting Jan that it doesn't hurt her. How much does this cost, by the way?
Well, it depends on how many areas we do. It starts around $1,500.
Right. And $1,500 is a lot of money, but compared to what you would do if you were doing a facelift or something that's a lot more invasive, and certainly in terms of the amount of trauma you're sustaining, you're with local anesthesia seem to be tolerating this pretty well. All right, now I want to put a picture up of what Jan looked like before we started the procedure. If you can put that up on the screen, so people can see that. All right. So you see there's some acne scarring there, and because you lost a little bit of weight, there's a loss of volume. You sort of sunk it in. All right, so you want to see what you look like now? So what I'm going to do is I'm going to fast forward into the future and show you what this is going to look like. Okay, because we got a picture of you as this will eventually look.
Okay.
All right. Now, I all right, so I don't want you guys taking more time. I want you going backstage, finish up immediately so everyone's happy as well as me and you.
Okay.